Everyone, welcome to this live event. My name is Dr. Rita Jabin, and as I promised you, I'll be going live as much as possible every Sunday. Thank you for joining. Today I'm going to be talking to you about pain, the different types of pain, and what you should know about pain. Oftentimes people assume that all types of pain are the same. Now, the first thing I want you to know is that now on Facebook, no network on Facebook. The first thing I want you to know is that pain is a communication of the body. When you experience pain, pain is not a disease. Pain is a way by which your body communicates to you. And that's why you should never be in a hurry to stop pain. Because if you are in a hurry to stop pain, you will miss the communication. When you experience pain, the first thing you want to find out is what is causing this pain. So before you even get to what is causing this pain, what type of pain are you experiencing is something that you need to take note of. Now, there's no network on this. There's no network on this. This has to be resolved immediately. Hello, thank you for joining thank you for joining. So today we're talking about pain. Please, if you have a question, you can drop it on the comment section. I'm live on Instagram, Facebook, and YouTube, so I'll be turning my face just across different screens. But today's health talk is something that you do not want to miss. For those joining us, my name is Dr. Rita Jabin, and I am a naturopathic doctor, and by that it means that I use natural herbal remedies to deal with complex health conditions. And today I'm talking about pain because I got a question last week on sciatic pain, and so I decided to talk about pain. And I said the first thing I said is that pain is the body's way of communicating that there is a disturbance. So never be in a hurry to stop pain. That's the first thing you want to understand. Now, pain is a disturbance, is a signal that there is a disturbance in the body, and it usually causes discomfort. So there are different types of pain, either different categories or different types of pain. I'm going to be running through that. There are two types of pain. A pain can be acute, or a pain can be chronic. Acute pain, these are sudden onset. Typically, they are short-lived. So an acute, sudden onset of a disturbance. It is usually often related to an injury or maybe an illness. That's why I said there is disturbance in the body. So that is an example. I'm going to go deeper into that, but that is acute pain. And then you have chronic pain. Chronic pain are pain that generally persists, that are not sudden. They come up, the onset is gradual, and then they continue to increase in momentum. And they can span from weeks to years. Those are chronic pains. So those are the two types of pains, if you may say. And so let's now go into further details or further analysis of this pain. Now let me now talk about under the categorization, because you can say two types, acute and chronic, and then under the category you also categorize it as acute, chronic, and the other types. Now there are basically about six category of pains. Now let's look at the category that is acute pain. These are sudden and these are short-lived types of pain. Now, examples of this acute pain. One could be from broken bone, from a fracture, from compression, from pressure, from excess heat. You know, hotness, heat can cause someone to have acute pain. It could be as a result of surgery. It could be as a result of this. Facebook is currently disconnecting. It could be as a result of surgery. It could be as a result of childbirth. It could be as a result of cuts from pressure. These are types of acute pain. Now, what are the characteristics of acute pain? Characteristics of acute pain. They can be very sharp pain. It just comes on suddenly, very sharp, aching. And these types of pain can be severe because their onset is suddenly. Sometimes it can just be a rupture of an organ. You know, so sharp, sudden pain that just come. It almost always requires immediate, urgent attention. In some cases, depending, it could be life-threatening. And in other cases, it could resolve on its own. But usually, sudden acute pain usually can be resolved with immediate treatment. Now, these are pain that comes suddenly, no onset. You just sleep and woke up with this sudden sharp pain in your abdominal region. You just wake up with this sharp pain in your pelvic region. You just wake up with this sharp pain at the side of your head. You just wake up with this sharp pain in your teeth, dental pain. You just wake up with this sharp pain in your eyes, sharp pain in your chest. Sharp, as though they are stabbing you. Acute pain are usually like as if there is a stab. It has characteristics of stabbing, it's piercing, it's sharp. Those usually are as a result of injury. Then we go to category number 2. Category number 2, this network is really messing up on Facebook, and I don't know why. Category number 2 is chronic pain. Chronic pain, this persists for months and can go into years. And they can even go beyond healing at some time. Example of chronic pain. It could be as a result of pain that has followed an injury that has refused to heal. It could be as a result of inflammation. So when you are dealing with chronic pain, there is an inflammation of an organ. The inflammation is what is triggering the nerve response that is causing pain. So it could also be migraine headaches. It could also be fibromyalgia. These are different things that can cause pain. Now, what are the characteristics of chronic pain? Chronic pain can be intermittent. That is that kind of pain that comes and goes after a while. That kind of pain that comes, you say, I used to feel this pain. It comes and then it goes. And then oftentimes they begin to form a pattern. They follow a season. It can be that during cold, you are used to have this pain in your bone. It could be during heat. It could be when you are in certain place. It could be associated with different things. Now, they also can involve changes with the nervous system. At this point, the nervous system is already being involved. What are the kind of pains? What are the characteristics? How does this kind of chronic pain look like? It can be dull. Oftentimes, chronic pains are not usually sharp. They are dull, persistent. The intensity is usually constant. That's one characteristic of chronic pain, is that it is constant. The way it is, that's how it is. The degree may not reduce. It may be increasing, and it is increasing steadily. So there is this waist pain that is just there. The pain is constant. It is dull. It is aching. It can be as if there is a nudge, like a prod, like something is prodding you, pam, 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 pam. It can be as if something is tying, like it's strangulating. It can be as if the characteristics can be as if it is like as if it is peppery. Then we have the third category, which is nociceptive pain. These are pain that are caused by damage to tissues in the body. Now, this damage to tissues in the body, it can be as a result of tear, it can be as a result of exertion, it can be as a result of different things can cause damage to tissues. Now, this kind of pain, they result usually when there is a dysfunction from the nervous system. Example of the things that can cause this kind of nociceptive pain. Sorry, I'm talking about nociceptive pain. Yes, not neuropathic pain. Sorry. So nociceptive pain are pain caused by damage to the tissues of the body. Now, this kind of pain, like I said, it can be aching, it can be throbbing, and it can be sharp. Now, this can come from inflammation. This can come from fractures. This can come from bruises. You bruise your hand. This can come from pressure. It can come from frostbite. This kind of pain can come from cuts, usually because as a result of damage to a tissue part. And it's usually aching. So you have headache, you have backache, you have stomach ache, you have all these aches in the body. Then you have the neuropathic pain, which I feel that a lot of people experience. Neuropathic pain, this one comes from damage or dysfunction of the nervous system. It is nociceptive pain that comes from damage to body tissues. But neuropathic pain comes from damage to the nervous system. Now, example of neuropathic pain or things that can cause it. This comes from nerve compression. This comes from nerve injury. This can also come from diseases like diabetic neuropathy. This can also come from other conditions that affect circulation. So when people have pain, the first thing they need to identify is what is the type of pain and what is the cause of this pain. Because oftentimes, good evening, oftentimes people will have this pain and people will be looking for pain relief. So if you are having a nociceptive pain, the approach should be different from a neuropathic pain, which is pain along the nerves. An acute pain, the treatment of an acute pain is also different from a chronic pain. Now, even in chronic pain, you have someone that has chronic pain, and then they have this pain. Inside this their chronic pain, there are periods of exacerbation when the pain have a blast, and then there are times when the pain will reduce a bit. The pain is still constant, but the pain is more like you say the volume of the pain increase, and then at some point the volume reduces, but the pain is still constant. It's still there. Then, so what are the characteristics? How do you know that the pain you are experiencing is neuropathic? The sensations are burning sensation. Sorry, I didn't get your question, Madam Miriam. Can you ask your question properly? So, okay, are you asking which one comes from poor circulation? Neuropathic pain can also comes from poor circulation. So, I was saying that how do you know a neuropathic pain? Neuropathic pain can be burning sensation. When you experience burning under your feet, burning in your palm, burning in some part of your body, you may be experiencing neuropathic pain. Also, okay, yes. So my question, okay, I get you now. So the pain that comes from poor circulation, that poor circulation can also cause is neuropathic pain. I hope you are clear now. Yes, neuropathic pain. And I said that has burning. The pain is burning you. It's burning like fire is burning. Neuropathic pain. Shooting. You know, as it's burning, like something is shooting at you. Pam, pam, pam. Neuropathic pain. Electric like, as if the pain is moving like a current, like there's a wave. Neuropathic pain. Those are types of pain that somebody has. Neuropathic pain. Now, other types of pain. Remember I told you that there are about 10 categories of pain. We have the visceral pain. These are pain that arise from an internal organ disturbance. For instance, the heart. Pain that comes from the heart as a result of maybe very high levels of cholesterol, maybe a blockage in the heart can cause a sensation of pain that is like it is constricting, like there's a tightness in the chest. Pain that comes from the lungs. These are types of pains that come from internal organ. They are called visceral pain. They are usually characterized by strangling, tightening, choking, feeling of choking, feeling like as if there is, something is, usually visceral pain, pain from the internal organ usually look like something is tying you, like, there's a tightness. Your stomach is feeling tight. Do you get it now? Your stomach is feeling tight. Your chest is feeling tight. Your pelvic is as if there's something tying you. Your leg, you see, these things, which is visceral pain. Then we have somatic pain. Somatic pain, these are pain that originates from the muscles, the bones, skin. Somatic pain will follow similarly like either nociceptive pain or neuropathic pain. This kind of pain can be cramp-like, as though there is a cramp. It can also come as though there is pepperishness. You see? Then we have referred pain. Referred pain is a pain that started, for instance, let me give you a scenario. If referred pain is a pain that the origin is from point A, but the manifestation is in point Y. An example of a situation where someone can be experiencing referred pain is in cases associated with the liver. Someone can have a liver disturbance, maybe cholelithiasis, maybe fatty liver, maybe maybe hepatitis. This pain, the person would be feeling the pain at the back of their shoulder. So the person is telling, I'm having this shoulder pain, I'm having this shoulder pain, I'm having this shoulder pain. Whereas the main place where the problem is from the liver. So if someone is not very well, if you go by, I'm feeling this pain, I use pain relief. Now, why do pain change in form? Sometimes pains change in form because people are quickly subside the pain. They quickly want to ease the pain. So at the time people are releasing the pain, the pain is changing. The body is, remember, pain is your body communicating to you. Pain is not the disease. Pain is not a disease. Pain is not something you want to cure, you want to stop. Pain is that message that the body is sending to you that there is a disturbance. for you to know the kind of disturbance you are having, that is the reason. That's why I'm educating people today, because often people will come and say, I'm having pain. And we say, oh, do consultation. They say, no, I am having pain. Which kind of pain are you having? That is why the pain is not going. Because you have not known the kind of pain you are dealing with. And when you are supposed to do A for the kind of pain, if you do Y, you will not get the results. Pain that are inflammatory, if you do not stop the anti-inflammation, if you do not take anti-inflammatory substances, and you do not stop the active inflammation, and do not identify the things that are triggering those inflammation, you will not stop that inflammation. The inflammatory pain will continue. So that was somatic pain and referred pain. Then we have phantom pain. Phantom pain are pain that comes because of memory of the pain that the person has had. It could be that pain that when somebody has that, so usually when the leg has been amputated, the leg is off, but the person is still experiencing pain. And also too, this kind of condition is deeply embedded in how the person feels in their emotions. Then we have psychogenic pain. Psychogenic pain are pain that manifests physically in the body, but the origin is from the emotions or based on emotional factor. Someone just lost money, and suddenly as soon as they heard that, they just started having this serious sharp pain in their stomach, or sharp pain in their legs, or sharp pain in their chest or something. Psychosomatic pain, or pains that have emotions as their source of origin. There's no amount of medication that they will take that may help to remove that pain. So it is important that you as a person, you understand the onset of that pain. Usually when people do consultation with me, I want to find out, when did this thing start? Oh, it started 2 years ago. What was happening to you? Oh, I just lost my mom, or I just lost my dad, and I was having this, and I was having that, and this was happening, and that was happening. All that put together can help to tell whether this pain is now fully on autopilot of emotions, or there is a physical underlining. Then we have breakthrough pain. I'm sure you are surprised that there's something called breakthrough pain. Now, this type of pain is inside chronic pain. Inside that pain that the person is experiencing, the person is already doing some treatment, then all of a sudden, bam, the pain goes up again. Now, these are the different types of pain that people have. Now, what causes pain? There are different things that can cause pain. And I explained the different things associated with the types of the pain that people experience. If you have a broken bone, you will feel pain. So usually as a result of trauma can cause that. Inflammation can cause that. Autoimmune diseases, where a system where the body attacks its own self, can cause that. Underlying diseases, some diseases make some pain to be positive. For instance, in conditions like high level of cholesterol is significantly linked to some of the cramps that people feel. But when people feel cramps in their body, they are not thinking of high cholesterol. They are feeling that it is their bone pain. Also, people can, conditions like high cholesterol, diabetes, whether the person is controlling it or the person is not controlling it, diabetes has a long-term complication known as diabetic neuropathy. That is when the nerves begins to be affected. The nerves of the body begins to be affected. Now, this pain that these persons are experiencing, if someone has diabetic neuropathy, the person would experience electric-like shock, electric-like pain. Remember I told you about electric-like pain. Pain, like electric, anything that has to do with the nerves. The pain comes as a wave. The pain comes like a fluid, like as if water is pouring, like as if it's usually associated with a fluid, like there's always a flow in neuropathic pain. It is also burning or pepperish in the way that the person would experience it. So the types of the pain determines what the person would experience. So how would someone know what kind of pain that they are having? From what I've said now, from the different classes of pain that I've explained to you, you would by now know whether the pain you are having is nociceptive, is visceral pain. You would by now know based on the characteristics of the pain. The characteristics of the pain indicates where the pain is originating from. So a lot of times when people say that they have arthritis, when there's arthritis is a condition known as inflammation of the bones. Now there is arthritis that is caused by wrong eating, which is as a result of storage of of uric acid, which is known as gouty arthritis. There is arthritis as a result of the body attacking the immune system, attacking itself. There is arthritis as a result of the body losing minerals. So even in arthritis, you need to know what are you experiencing. So you're having complaints around your bones, you need to do tests. Laboratory test is always a plus. It's always an advantage. And I will say to you, if you run tests, all different types of tests, blood works, and all your blood works come clean. For instance, you're not diabetic, you're not hypertensive, your ESR level. So, by the way, one way to check level, one of the simplest way to check inflammation in the body is a test known as ESR. Suppose normal levels of ESR usually 0 to 20, depending on the testing matrix. When you see some people that have like 120, it shows that pain is caused by inflammation. And until that inflammation is resolved, that pain will not go. So, what else? What am I now saying to you? So you do your test, your ESR test, and your ESR shows you that you have high levels of inflammation. Then you want to bring down those inflammation. And I did a video some days ago. I'm sure the videos are everywhere. If you check the Instagram page, check the Facebook, check TikTok, it's everywhere. On 8 common inflammatory foods. Now, those are not all the inflammatory foods, but those are common and types that people don't even know. Okay. Now, someone is experiencing those inflammatory pain. Then you run your test. By the time you run your test, the doctor who is sending you to do tests would have taken your history, would have known, in the course of talking to you, the person would have known that, okay, you are experiencing this, okay, this is what is happening with you, and that is what is happening with you, okay, this is your lifestyle, because some of this pain can be triggered from wrong lifestyle. Sitting position can cause either nociceptive pain. Good. So the test you did shows that you have high uric acid. Thank you very much. So this person, someone is responding to me on Instagram. The person says she's always having cramps on her calf. And the test, so she's always having cramps in her calf. Remember I told you, that is what? That is nociceptive pain. The kind of pain you are experiencing is nociceptive pain, which is as a result of damage to the tissues. And this is usually caused by inflammation. Now, if you've done a test that shows that you have high level of uric acid, the solution to that bone problem is not to take anything to reduce pain. It is to initiate a therapy that is going to bring down that level of high uric acid that you are currently experiencing. Then when you bring out that high level of uric acid that you are experiencing, you now need to know what you are supposed to avoid. There are foods that are natural. You see, there are foods that are not bad. But when you consume them accumulatively, they cause your uric acid levels to be high. Now, these uric acid levels are they are natural, they are normal for the body, but excesses of it will cause the body to store them in the joints. When the body is storing them in the joints, it is going to be causing for the body pain, which is a nociceptive type of pain. So, Madam Miriam, I suggest that just immediately after this live, subscribe for our bone set. Our bone set, you will have your consultation. When you have your consultation, we will look at your test. When we look at your test, we will now know what we need to add or what we need to remove, especially your food. You need a food guide also to know what to avoid and all of all that. So that was a case study on nociceptive pain. So when you know the cause of pain, so imagine this person. Now, thank you so much for giving us using yourself as a case study. So you can imagine that someone has pain in her calf, and then she also has the pain in her legs, and the pain is cramping, which is nociceptive pain. Now, this person is going about drinking ibuprofen or drinking any pain relief, or even goes to meet someone and buys medication and say, I want to just use this thing. What the person would experience is that now, for such a condition, that's already a chronic condition, because it's not sudden, it's gone. Now the person will be experiencing, when the main condition is not addressed, the person will be experiencing pain breakthroughs. That means that suddenly the pain will go high, suddenly the pain will come, so after a while it will come down. Maybe peradventure the person maybe engages in some activities that are anti-inflammatory in nature. It may cause the pain to reduce, and then the person goes and takes something, the pain will break up again, increase. So you find these people say, I've been having this pain for like 5 years now. The pain will come, it will go, then it come, it will go, then it has come permanently, it's not going. Then all of a sudden, for the past 4 months, the pain has been consistent and has been increasing. They are experiencing what is known as a pain breakthrough. The pain is breaking in while they are on a particular treatment, and they feel like, oh, the treatment is not working again. They go higher and higher and higher. The truth is that the origin, the type, the cause, the diet, the lifestyle has not been identified. So it is always cheaper to first do a consultation, do tests, know the risk factor and the obstacles to cure before you embark on any therapy. And that's why my combo is put together in such a way that if you get the combo, you will have your consultation first. When you have your consultation, you will now do your test, or you bring your result that you have done. Then you will now, based on your test and your results, you will now have a dietary, lifestyle information. Okay, these are the things you should not eat, these are the things you should avoid, these are the things you should do, these are the things you should not do, and all that, and then you get a therapy. Because if you don't identify what is the trigger, even if you have gotten therapy and you have even gotten up to 90% or even 100% of relief, I tell you that as soon as you expose yourself to the same risk factors, to the same inflammatory substances, you pick them up again. It's like putting fuel, putting fire. If you are trying to put off a fire, and you are pouring water, and the fire is going out. Thank you very much. Good. So if you have bought the bone set combo, use it. Did you do your consultation? Did you do a consultation? Or you just bought products? Buying products is different from buying the full combo that has consultation in it. Oh, very, very important. Don't say that you bought product and you did not do consultation. You must make sure that you do consultation. Don't just buy product. Make sure that you, when you want to buy, make sure that you insist that you want to do consultation first. Then you will now show your test results. Then you now get the product. Because when you do that, you get a food plan of what to eat and what to avoid. Some people will come and just say, I just want to buy this one, buy that. They buy. They have not done consultation. They have not known what is causing their problem. They have not known what to do to prevent it from coming back again. It's very, very important. Very, 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 very important. And that's why I said I'll be going live as much as possible, as much as I can. Every Sunday, I'll try my best. Not more than 1 hour. Go live, discuss issues. My dear, do consultation. Do consultation, madam. Do consultation. You see, do consultation is very important. So, as I was saying to you, I said, make sure that, thank you so much on TikTok. I'm seeing, sorry, I'm not even acknowledging. Let me read the message on TikTok. How do I get to the message now? Can you send me the message they sent on TikTok? What is the message? There's a message. I'm seeing a message notification. Just a second. But I saw. What is the message? So just a second. Just making sure that I am. Okay. I'm trying to get question that was sent to me. I want to try as much as possible to answer everybody's question. I'm not able to. All right. Thank you very much. Okay. On Facebook, what's happening on Facebook? Can you see me? Are you there? Facebook network seems to be slow today. Not sure why. All right. So, yeah. Thank you very much. Okay. Have you seen the question? I'm trying to look out for the question. So, pain. All right. So, how do you manage pain? So, someone asked me a question, sciatica pain. Sciatic pain. What is sciatic pain? So, there is a nerve in the body. The nerve in the body from your bum, divided into two, is called the sciatic nerve. That nerve runs all through from your waist down to your leg. It is divided into left and right. That pain that originates from the sciatic nerve is under the neuropathic nerve pain, which I have already talked about. All those burning sensation in your leg, all those stabbing electric sensation, all those things like there's needle pricking you, sensation of needle pricking you, all that are all neuropathic type of pain. And I tell you the truth, you need to know what is causing your neuropathic pain. Until you know what causes your neuropathic pain, you will not be able to solve it. Also, you also need to, okay, thank you very much. All right. Also, so when you know what is causing your neuropathic pain, so that's sciatica, that's what they say sciatic. Now, remember I told you that for neuropathic pain, one of the causes could be crushing, could be slip disc, could be, injury, trauma, pressure, compression, all that. That's why bad posture can cause you to have nerve pain. You see those of you that used to sit down, I can, you know how you sit down like this? I hope you can see me. You know the people who sit down and bend on the chair like this? Their back will not be like It's only a matter of time before you start having lordosis, scoliosis, different kind of cysts, even slip disc. You see, where nerve become trapped in between bones. Excessive exercise. I didn't say exercise is not good. I said excessive exercise can cause injury. Know yourself, no because so. Know your limits, no, because you have to know what it is, what is your limit, what is the maximum limit your body can take, and do not go beyond that. Very important. On Facebook, are you people still there? Please respond on Facebook if you are there and let me see you. So, when you are dealing with pain, what is the best thing to do? When you are dealing with pain, especially when you are not sure what is triggering the pain, do not go and start with doing massage. Listen to me. Do not go and start to doing massage. Why? If you are having a referred kind of pain, if you are massaging the wrong, if you are having a referred pain, which is a pain that originates from one place, but is being felt in another place, if you are having a referred kind of pain and you are massaging the wrong place where you are feeling that pain, because you are not aware that it is a referred pain you are feeling, you are massaging the point where you are feeling the pain. For instance, you are feeling pain under your scapula. This is your scapula. Under your shoulder is your scapula, and you are having your shoulder is paining you, and you are not aware that that is coming from your liver that has, and your gallstones that you have, which is coming from, do you understand? Or also inflammation of the liver. One very classic sign that gallstone is that pain that people feel under their shoulder. High level of cholesterol. So the person is busy massaging the shoulder. After a while, he will come and give himself injury on the shoulder. Why is he going to give himself injury on the shoulder? He's going to give himself injury on the shoulder because he's not aware that it's high cholesterol that he's dealing with. The same thing with the leg. So until you are sure that the pain you are feeling, it is not a referred pain, and it is consultation, it is laboratory test that will find out. Then also, because it's not in all cases that massage will help you. Sometimes massage will, a problem that should have been 10%, you massage it into 99% and have plenty more problem because it causes more tissue injury. The one thing, another thing that you should not do when you're having pain, avoid vibration technique. You know, all of you now, you just see massage. You say you don't want a physiotherapist. You don't want to go and meet a professional. You now go and say there's this massaging machine. You now sit down there. You now vibrate. You be vibrating your body. You are causing. Remember, I've told you the different classes of pain. I listed the 12 classes of pain for you right now. Until you understand, vibration technique should only be done by a professional who has analyzed your body, who has also, because sometimes if it is as a result of a tissue injury, that vibration in that high molecule, that high frequency that you put on that tissue, you cause for that injury. You feel relief temporarily and get worse after. Sometimes in the course of treatment, especially when a tissue has been injured and you are doing treatment, it is also sometimes somebody can have mild tissue injury and mild pain, and then after a while the body begins to recuperate. That's very normal. So things that you should not do when you're having this pain. One, I said to you, don't go and be doing massage. 2, don't do vibration. Don't carry vibrating machine. Don't vibrate your shoulder. It is high cholesterol. So another reason why those vibrations may not be very good for you is because if you are dealing with, sometimes it may be as a result of thrombosis, means that there's a clot somewhere. You're going to be vibrating it anyhow. It may go and block a smaller artery and now it may cause you to lose a body part. So, do not do vibrations, do not do massage, especially all those manipulations outside of a professional. Number 3, avoid you. So in the next thing you need to avoid in excuse me, in dealing with bone related problem of a body part is avoid cutting that part. You know when people say they now cut a body part, they now cut something and now put something inside. Avoid cutting, avoid piercing into that body part. So you see, you're asking what about using heat belt on the waist? Wait, now that's the same thing I've been saying to you. If you have high level of uric acid, that you have said that high level of uric acid is what you have, that heat, uric acid will cause the body responds by bringing out heat. You now bring another heat again. Heat therapy is one of the ways to treat the body. In fact, I will tell you that the two types of pain that benefits from heat the most, that heat will do well for, are neuropathic pain, nociceptive pain. All other types of pain, if you are using heat for them, you are causing more injury. If you have high level of uric acid, go and bring the uric acid down. The pain will stop. So please, because pain is, remember that pain is not the sickness. Pain is your body telling you that there is an injury. And when there is an injury, one of the things you want to make sure that you do is that you prevent that injury from becoming more injured. Very, very important. Very, 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 very important. So, as I round up these things, I've told you, I said, heat is very good. If anything, another thing that you can do when you are having pain, as much as you can, try and do movements. You see, if you are having pain, especially pain that is nociceptic, chronic pain, visceral pain, psychosomatic pain, all these kind of pains, all the pains, as much as the pain can tolerate. If it is an injury that your leg is broken and you are on immobility, maybe you are on traction, you know you are going to be in one position, you may not be able to move all your body parts. As much as you can, you will be told, shake like this, do like this. Exercise is one of the best thing to do, as much as you can tolerate. As much as you can tolerate. So before you go and put ice water on your leg, hot water on your leg, hot aboniki on your leg, build vibrating machine that will vibrate the tissue into further injury, manipulate, you know, down that you lie down and say, mash my back. Hey, you see your spinal cord is your lifeline. Those of you that will lie down and say, oh yeah, mash it. If you experience, this is one of the rules for you to know that there is a serious disturbance within the nervous system, you know, the nerve activity. If you have a sudden urge to always have to lie on a firm surface, it means that something. I ask you to eat okra soup. Every plant, okra does not have uric acid, madam. No. Okra does not have uric acid. And go and do study on uric acid and see it. I did not ask you to drink okra. I said eat okra soup. And it was a general information. That is why you need to do a consultation for your own body, for your own self. So that's what let us put down by one side. But okra does not increase your uric acid. If you go and watch the videos that I've done on the teaching of uric acid, you will see it. I've done a video. Go on the page and go and look at it. You will see it. So okra does not cause you to have high level of uric acid. No, it doesn't. Na lie. There's no scientific backing that shows that. If anything, it's a good plant to eat as soup. I didn't say as drink okra soup. I said eat okra soup. And it's not only okra. It was a full ingredient and list of other things that was said. So don't take out one thing and use it. No, take the whole thing that was said. So as I round off this live service today, I want you to remember the different types of pain. Pain is categorized into acute or chronic. First of all, pain is your body communicating to you that there is a disturbance in the body. Second of all, pain can be acute, which is something that comes suddenly, and sudden pain requires sudden urgent attention. Sudden urgent attention. And if they are dealt with on time, it could be life-threatening. It could be an indication that there's a rupture of an organ. It could be life-threatening, and it could also, but if you, when sudden pain is handled, it can be resolved fast. Then there is chronic pain. Chronic pain builds up over a period of time, and under that, I said there are about 12 categories of pain. Under the categorization, I told you that there is acute pain, and I told you characteristics of acute pain. Acute pain is usually sudden, severe pain, sharp. Acute, sharp. Then there's the chronic pain, which happens over a period of time, and then it can also be go now, come back again, go now, come back again. But the characteristics that it is dull, constant, present, always there. It's just there. It's just there. It usually starts coming and going, and then it now remains there permanently. Then you have the nociceptive pain, which is damage to body tissues, and it's characterized by ache. That place is aching. It is throbbing, and it is sharp. And then you have the neuropathic pain. These are pain from nerve injuries or nerve issues, dysfunction with the nerve. This pain can be burning, anything burning is burning me, burning sensation, peppery sensation. There is like electric current, the pain is flowing. The pain used to flow from this place to this place. Flowing pain is associated with that. Then we have the visceral pain. We have the referred pain. Yes, continue with your combo. You have pain, somatic pain. You have referred pain. You have phantom pain. You have psychosomatic pain. You have breakthrough pain. Pain that just increase. You are on a therapy and the pain just suddenly increase in intensity, become unbearable. And I said to you that you must find the cause of the type of the pain that you are feeling. The cause determines the type of approach. And I said to you, when you are dealing with any kind of pain, things to avoid doing. One, I say avoid doing massage until you are sure that massage, the kind of pain that massage relieves is neuropathic pain. That deep massage really works for neuropathic pain. But you must be sure that you have neuropathic pain. You must be very sure. And I said, because if you have a tissue damage, further massage may cause the damage to increase and you get worse. You may in pain management, it is very important that you don't increase the damage to the tissues. So you must be sure. And then I said you must do laboratory tests. There are quite a number of laboratory tests. Check my page. I've told you tests to do to check your bone. I do tests to do to check your bone is there, about 7 to 8 tests. Go there, check it on the page, Ask Dr. Rita Show. You will see the video there. I've also done test video on uric acid. What is uric acid? And I've told you some of the common food sources that have uric acid. These things are things that you need to and you need to take note of these things. Then also, in rounding off, I said to you that you should avoid vibrations. Avoid vibrations. Any kind of pain that you have, whether neuroceptic, any kind of pain, avoid going to use those things that vibrate. Avoid it. They have more sorry, 1 second. They have more, I said, what was I saying? Someone was asking me a question. That was what took my mind. I said vibration. Yes, I said, yeah, I was talking about vibration. I said vibrations will cause you more injury. Avoid vibration technique. Anything that they want to do for you that is vibrating. Then I said also avoid using extreme, very hot or very cold on your body parts. Without, those are techniques that professionals will be able to do and you'll be safe. Avoid, don't use goggle to go and cause more further tissue damages. The reason the pain is not going may be because you have not identified the root cause. Also, it may be because you are causing further injury. And I'll see you next week. The question that I will answer next week, today I've talked about the bones and I've answered questions around pain. All the type of pain that people can experience in this life. I've talked about it in this 1 hour. Therefore, next week I'm going to be talking about the heart. I'm just going to talk about the heart, general things you need to know about the heart, blood pressure, cholesterol, and all that. As much as I can, I'll try to go live every Sunday and let you know. Thank you so much for logging in this live. I'll see you next week Sunday by 6 p.m. prompt. Have a beautiful evening. God bless you. Bye.